Greetings. Thank you for watching the preoperative spine class video. This video is for those who will be staying in our hospital after their procedure. There is a different video available for those undergoing an outpatient procedure. The purpose of this video is to provide information about how to prepare for your upcoming surgery. It is important to begin planning now to promote healing and recovery and also prevent unwanted complications. Topics covered include pre-anesthesia testing and medications, an exercise and walking program, preventing complications, preparing for discharge from the hospital, and customer service and outcomes questionnaires. Finding your way around our campus can sometimes be a little challenging. We recently updated our signs to make it easier to find your way. We also have an app available that can help with directions. Look for UTMC Way in the Apple's App Store or Google Apps. You can scan the QR code with your smartphone's camera and get a direct link to download the app. For those having surgery in the main operating room, I recommend parking in Parking Garage 1. Parking Garage 1 was previously marked as Parking Garage H. Enter through the Fountain Circle entrance. Registration is located in the lobby of the Heart Hospital. The surgery waiting room is located on the second floor of the Heart Hospital. The Neurospine Nursing Unit is located on the 6th floor of the South Pavilion. Pre-anesthesia testing is conducted by our anesthesia office. Testing and assessment will include an interview with a nurse for your health history, a review of your medications, and a review by an anesthesiologist. It may also include lab tests, EKG, nurse assessment, and review of records from specialists. When you attend your pre-anesthesia testing appointment, they will review your medications with you and provide instructions about what medications to continue and which ones to stop prior to your surgery. It is important that you stop all aspirin, aspirin products, and NSAIDs, non-steroidal anti-inflammatory drugs, for 7 days prior to your surgery. Tylenol, acetaminophen, may be a safe option. Please check with pre-anesthesia testing or your surgeon's nurse to confirm. If there are any changes with your medications, anything new prescribed or anything discontinued, contact your surgeon's office or pre-anesthesia testing to inform them of the changes. They can advise you whether it is safe to make the changes before surgery or if you should wait. Keep them informed. If you have any questions about your medications, please contact either your surgeon's nurse or pre-anesthesia testing. The telephone numbers for both of these are on the slide. Preparing for your stay. Your surgeon can let you know how long they expect you will stay with us. For those who will stay with us 1 or more nights, we recommend you bring a few things with you. Loose-fitting clothing. We will have you up and walking around the unit, and you may prefer to wear something other than a hospital gown. We recommend loose-fitting clothing, shorts, sweatpants, loose slacks, t-shirts, pajamas, anything that's loose and easy to put on or off and is not tight or constricting against your spine. We also recommend bringing a nice pair of walking shoes. Non-slip socks are provided, but if you prefer to wear shoes, please avoid wearing flip-flops, open heel slippers, clogs, or rocker bottom shoes. These can increase the risk of falls. Personal entertainment. We have televisions in every room, but feel free to bring a book or magazine or a crossword puzzle if you prefer. We do have free Wi-Fi if you bring a web browser or a tablet. Personal care items, toothbrush, toothpaste, deodorant. And if you have a CPAP that you use at home, please bring yours with you. Give it a thorough cleaning before you arrive. What not to bring with you. Please do not bring jewelry, watches, large sums of cash, or credit cards. Do not bring any home medications. Nursing and pharmacy will provide and track your medications. We keep walkers in every room. If you bring one from home, please ask nursing or therapy to inspect it and place a label on it identifying that it goes with you on discharge. On the day of surgery, arrive at the instructed time. You start in the registration office located in the lobby of the Heart Hospital. Here, you will complete the registration paperwork and will receive an identification bracelet. Next, you go to the surgery waiting room on the second floor of the Heart Hospital. Check in with the attendant at the information desk. When the surgical team is ready, nursing will escort you to the pre-op room. Nursing will go through a safety checklist and help you prepare for your procedure. Next, you will go to the holding room, where you will meet with nursing, anesthesiology, and your surgeon. Next, you are taken to the surgical suite. The duration of surgery can vary quite a bit. Your surgeon can let you know how long they expect your surgery will last. We do ask that your family remain in the waiting room. If there are any delays, the surgical team will inform them. If your family does leave the waiting room, they should provide contact information to the attendant. After surgery, you are taken to the post-anesthesia care unit, where you are monitored as you emerge from the anesthesia. Your surgeon will meet with your family to give them an update. During your stay, you will stay in our neurospine unit, which is on the 6th floor of the South Pavilion, also called 6 South. What to expect after surgery. Activity. It is important to avoid prolonged bed rest or inactivity. There are rare occasions where your surgeon may order bed rest, but this is not common. Walking is key. Sometimes this begins the day of surgery, but more often it starts the day after surgery. It is a gentle progression. The first time up may be as simple as moving from the bed to the chair and walking around the room a little bit. As you are able, we will go longer distances. Nursing will help with mobility, and physical or occupational therapy may also be asked to assist. Deep breathing exercises, incentive spirometry. We monitor your oxygen levels after surgery and will provide supplemental oxygen initially. We encourage deep breathing exercises and provide an incentive spirometer. This is an effective way to keep your lungs clear. Intermittent compressions. Anytime you are lying in bed, we will apply compression sleeves to your lower legs. These sleeves attach to an air pump that will cycle on and off repeatedly. After some cervical fusion procedures, we will screen to ensure you are not having difficulties swallowing. It is common to experience some hoarseness or discomfort, but if you have difficulty swallowing foods or liquids, please let nursing and your surgeon know. After surgery. Nausea. Some may experience nausea after receiving anesthesia. Nursing will monitor for this. If you have ever experienced nausea after anesthesia, please inform the anesthesiologist prior to your surgery. There are medications they can provide to help prevent this from occurring. Constipation. This is a common side effect of pain medications. Nursing will monitor for this and can provide ordered medication to address this if needed. It is also recommended that you have an over-the-counter medication, a stool softener or laxative, at home to help restore normal bowel function if needed. Surgery site care. When you are discharged from the hospital, you will be given both verbal and written instructions on how to care for your surgery site. Proper care is important to promote healing and prevent complications. Discharge planning. It is important to begin preparing now for your return home after surgery. Some of you may need a short stay in a rehab facility before returning home. If you believe you may need this, I recommend reaching out to your preferred facility to begin the admission process. If you need a list and contact information for local facilities, We partner with many facilities as part of our community care network and can provide more information. Most people are able to return directly home after surgery, and there are a few things you can get in place to prepare. First, and probably most important, arrange to have someone stay with you. How long can vary. For some, it may be only a day or two. For others, it may be longer. Have a plan for meals. Stock your pantry if needed. Maybe prepare meals ahead of time, or have a plan for who will prepare meals. Remove tripping hazards. Throw rugs, extension cords, clutter, and pets. Having a pet certainly does enrich our lives, but there is a fall risk. Have a plan on how to minimize your risk. If you live in a multi-level home, see if you can arrange so all of your needs are on one level to reduce how often you need to use the stairs. If you believe you may need an elevated seat for your commode or a shower chair, arrange for these beforehand. I also recommend keeping a cell phone or portable phone on hand at all times on return home. If there is an emergency, you can call for help. Also important, a good pair of walking shoes. Walking is going to be a key part of your recovery. Your surgeon may ask case management to see you during your hospitalization. They can work with you to arrange for equipment or service needs on discharge. A progressive walking program will play a key part in your recovery after surgery. The research shows that it does lead to significant improvements in quality of life, improving fatigue levels, and physical function. We also have good evidence that it improves cardiovascular health and reduces the risk of some health problems. We also know that it aids in recovery by restoring your mobility and is an important part of promoting healing and speeding your recovery. Walking is a healthy way to begin your body's rehabilitation. As mentioned earlier, use a good pair of walking shoes. Look for sturdy but flexible non-slip soles and a closed heel design. Choose a safe walking path. Whether indoors or outdoors, pick a path free from clutter or other fall hazards. Use good form. Keep your head up, attention forward, shoulders slightly back, and feet pointing forward. Use a natural walking form with an erect spine, good step length, and natural arm motion. Breathe naturally and avoid holding your breath. Stay motivated. Set daily goals and track your progress. Find a walking buddy or partner, someone who will encourage you to keep going. Schedule your walks. Choose a convenient time and try to stay with it every day. We recommend what the Centers for Disease Control and the Academy of Sports Medicine recommends. 150 minutes of moderate intensity cardiovascular exercise per week. Break that down to 30 minutes a day, 5 days a week. And if you are limited with how long or how far you can walk, start easy and progress gently over time. Start with a 5-minute walk, twice a day. Then add a minute or two every day with the goal to get to 150 minutes or more per week. Current research indicates that we benefit as much from multiple small walks every day as we do from fewer long walks. With any exercise program, if you experience signs of heart trouble, seek immediate medical help. Movement strategies. Safe lifting. After your surgery, your surgeon will inform you of any lifting restrictions. Typically, you should lift no more than 10 pounds. With any lifting, you should use good mechanics, keeping your spine in a safe, neutral alignment, and power the lift using your arms and legs, not your back. Avoid twisting motions. To turn, pivot with your feet rather than twisting with your back. Use a log roll technique to get in and out of bed. Keeping your spine straight, roll like a log onto your side, kick your feet off the edge of the bed, and use your arms to push yourself up sideways without twisting. Use the same technique in reverse when getting into bed. Getting in and out of a car, turn rather than twist to place your feet on the ground and stand up. Preventing infections. These measures can significantly reduce the risk of infection. If you are diabetic, it is important to manage your blood glucose levels. Uncontrolled glucose levels increase the risk of infection. Stop smoking. Smoking significantly increases the risk of infection. Illness. In the week prior to surgery, if you develop any kind of illness or infection, contact your surgeon's nurse and inform them. They will work with you to determine if any interventions are needed. A surgery cleansing procedure. Performing a cleansing procedure can significantly reduce the risk of infection. Details will follow shortly. Ask friends and relatives not to visit if they are ill. Wash your hands frequently. Friends and family should wash their hands when they visit. Your medical team is required to wash their hands on entry and exit from your room. If anyone fails to do so, just ask them to foam please as a reminder. Excellent oral hygiene. Brushing teeth frequently has been shown to reduce the risk of sepsis and other infections. We will change the linens on your bed every day. If anything happens that we need to change them more frequently, let us know. If the dressing or bandages on your surgery site become loose or saturated, let us know. We will inspect the site regularly and need to replace or reinforce any dressings that are not secure. If you have a drainage tube, let us know if it becomes loose or leaks. Family and friends should not touch the surgical wound or dressings. Sometimes curiosity can prompt people to want to see the surgery site. It is important to keep it covered and protected. We would like you to perform a pre-surgery cleansing procedure using chlorhexidine gluconate, or CHG. HibaCleanse is a common brand name. Research has shown this can significantly reduce the risk of infection. We would like you to perform this cleansing procedure 3 times. 2 nights before the surgery, the night before surgery, and the morning of surgery. Use a freshly laundered towel and washcloth with each procedure. Note that the HibaCleanse CHG can stain your washcloth. You can use a new, unused sponge instead. If you choose to use a sponge, use the soft side of the sponge, not the scouring pad side. To perform the procedure, wash your hair with your normal shampoo and conditioner. After, fully rinse your hair and body to remove all soap. Wet a clean washcloth or sponge, and then turn the water off. Apply the CHG soap to the clean, wet washcloth or sponge. Thoroughly wash your body from the neck down. Do not apply the CHG near your face, eyes, ears, or genitals. Gently wash your body for 5 minutes. Focus on the area where you are having surgery. Use the whole bottle of the CHG soap with each treatment. Allow the treatment to dry for 1 minute. Then turn the water back on. Fully rinse your body. Do not shave the parts of your body where you are having surgery. Pat yourself dry with a clean, soft towel. Do not apply any lotions, powders, perfumes, deodorant, or makeup. Do not use any alcohol-based hair or skin products. Put on clean clothes after your shower. Place clean sheets or linens on your bed after the first treatment. Smoking cessation. We all know and understand the risks and impacts associated with smoking. With surgery and smoking, it is important to recognize there are added risks. People who have surgery and smoke have more frequent complications and worse outcomes. increased risk of infection, increased failure rates, and more difficulty with pain control, and longer recovery times. Smoking interferes with the healing process. If you smoke and can stop, even if for a short period, it will help with your healing and recovery. Follow-up. Keep your follow-up appointment with your surgeon. Eat well-balanced meals and drink plenty of liquids to help promote healing. You can use ice over the incision for comfort and swelling. Please do not drink alcohol or drive while taking pain medications. Call your surgeon's office if you have any questions or concerns, and please continue your daily walking program. Call your surgeon's office if you have any of the following: a persistent temperature greater than 100.5 degrees Fahrenheit, severe pain that is not relieved by your medication, increased redness, swelling, or tenderness of your incision, or persistent drainage from the incision, especially if there is a foul odor, substantial tenderness in the calf of either leg. If you experience chest pain, shortness of breath, or difficulty breathing, call 911 or go to the nearest emergency room. Questionnaires. You may receive questionnaires from two different entities. Press Ganey will randomly select people to survey to learn about their experience. If you receive this survey, please complete and return it to them. Our intent is to provide excellent service and to recognize our team members who go above and beyond. If we have not met expectations, please give us feedback. We want to learn where we can improve. The American Spine Registry. The Spine Center partners with the American Spine Registry to measure patient outcomes. You may receive an email requesting you complete an online survey before your surgery and then again at 3 and 12 months after surgery. This allows us to measure the changes in your pain, movement, and function.